Top 5 reasons you should get a denture. Welcome to the SmileLine podcast. The purpose of this podcast is to give real information from doctors and patients about our SmileLine prosthetic and the sequence of appointments. For more information, check out our website or give our office a call. Hope you enjoy today's episode. All right, guys, welcome back to the SmileLine podcast. I'm here with Dr. Sam today. And today we're going to talk about the top 5 reasons you should get a denture, and then stick around to the end because we're going to cover the top reasons you shouldn't get a denture and should consider implants.
I thought it was Orange Shirt Friday, man. Like, what happened to that?
I was getting there. It is Orange Shirt Friday. We coordinated
don't call
this
each
morning.
other.
You don't?
No. It's telepathic.
Yeah. No, our wives laid out the same clothes. That's what it was. It's
a standing joke in the office right now because it's happening like 3 days a week. So
yep.
Hang with us. There will be a time when we don't have the same shirt on.
All right. So nice to have you back on. Been out of the office a little while and been out of podcasts, huh?
Longest time ever away from the practice. Longest time ever away from my family. Just got back from northern Alaska, caribou hunt, and I mean, we absolutely slayed the caribou. Stay tuned on Huntline TV. A lot of new stuff coming out there. New editor, new production, some new staff members there. But today is all about the top 5 reasons you should consider getting a denture.
Yeah.
Let's jump into that.
So what is the top reason you should get a denture?
So the top reason that you should get a denture is because you can't afford anything else. I don't think there's anything else that ranks at that level. But I think it's a very valid reason. And we tell people on a weekly basis when they come in and we just can't find a way financially that, maybe starting with just removal of infected teeth and getting healthier and starting somewhere, that's probably the thing that, if we get to that point in the consult and they're being honest about what they can afford, that might be the number one reason.
Yeah, because there are a lot better options out there, and we'll cover that later on. But yeah, sometimes whenever you got a budget and that's it, that's when we're starting to look at dentures.
Yeah. I think a denture, the number 2 reason I think that you would consider doing dentures is because it can improve your cosmetics so much. Like if you're a patient that can't smile, that is your personality is affected, you struggle to get a job in a job interview or be selected from your job interviews because your presentation is so poor. That would be another reason. So if you can't afford it, number 1, and number 2, if it's affecting your quality of life and your ability to get work, certainly your ability to function, but your ability to get work, that would be another reason that I would say, you got to do something.
I agree that number 2 of the cosmetics. I mean, the dentures, they look good.
I mean, hey, I can make a denture to look just as good as a SmileLine. I really can for most people. That maybe not everybody, but for most situations, when you set those dentures in there and you hold them in place and you ask a patient to bite and smile, I can snap some pretty cool photos.
Oh yeah, the photos look good now. Yeah. Now wearing them, laughing, gluing them in, that's all side point. But like for the camera, you're gonna look good.
Yeah. I think the third reason that you should consider getting dentures is just a very objective one. It is you don't have enough bone for any other options, any other implant options, snap-on dentures, fixed prosthetics, SmileLines. Like you just don't have the anatomy. And the surgical invasion to try to build the bone up, the grafting procedures that would be required where you might have to, harvest bone from your hip, your tibia, like there's different harvest sites that are kind of go-to for the general surgeons out there. Unless you've had a macro trauma like a car accident or something like that, like it's probably not something that most people are willing to do to get to the point where they can get implants. So I think just not having enough bone, limits your options to the point where a denture might be the only thing on the menu.
So What kind of percentages are you talking about here? Because I hear it a lot in consults. They're like, yeah, my other dentist, they said it didn't have enough bone for implants. I guess I can only do dentures, right?
Right. So, I mean, how many times a week would you say that we tell a patient they do have enough bone for implants and they're a little perplexed because they just came from somewhere, or somewhere in their dental past they've been told they didn't? Like,
about all of them.
Yeah.
It's a couple times a week, though, whenever they've been told that, and they come in with the preconceived notion of, like, I can't do implants, I have to get a denture.
Yeah. And I think that people are so scared of the cost of implants that they're kind of open to any excuse to, like, justify not getting implants. But I'm here to tell you that, the techniques that we use allow us to utilize foundational bone that most surgeons wouldn't want to utilize. And a lot of it is kind of semantics. It's like those dentists that are, when they're saying that they don't have enough bone for an implant, they might have been talking about replacing a certain area of their mouth, and their teeth have a lot of bone loss. So it rules them out as a good candidate for what we call single implants, but it rules them in for full arch implants. And most dentists don't have a streamlined path. A lot of them have a path, but they don't have a streamlined path for converting patients from their existing either, toothless, edentulous situation, or, bad tooth situation, their dentate situation. They don't have a streamlined path to converting that patient to a final result quickly and efficiently and affordably.
Yeah. I mean, what those other dentists aren't telling the patients the wrong thing. It's just a slightly different thing, and we had use a different technique, place implants in a different spot. So what they're telling patients isn't wrong at that office, but at our office, we get a lot more yeses.
Yeah. We're looking at your anatomy in a different way. We're certainly looking at a 3D X-ray, and we've engineered and really learned. I learned the surgical technique we have from Frank Lamar up in New York. I certainly can't take credit for it myself. But man, when I learned that technique from him, I was like, man, I love the versatility of human anatomy that you can work with taking this approach. So it allows us to say yes when a lot of people have to say no.
Yeah. So what about number 4? What's number 4 on your list?
Number 4. Number 4 is a medical condition. So there is a class of drugs out there called bisphosphonates, and there's some back and forth in the literature in the dental field on whether or not patients should get implants if they're on this class of drugs. These are your Actonel, Fosamax, Iridia, Reclast. There's several of them. And this class of drugs is given to people that have osteoporosis and to people that have bone cancers. And the dosage of this class of drug for people that have osteoporosis is relatively small compared to the people that have bone cancers. So my personal philosophy and my comfort zone as a surgeon, and this is built through, probably hundreds of implants that I've done on people with bisphosphonate drugs for osteoporosis, is that it is a very predictable procedure yet for patients on this class of drugs, as long as they're being prescribed those class of drugs for osteoporosis. If they're being prescribed bisphosphonate therapies, which are usually IV, not pills now. Osteoporosis is usually a pill. And so if they're being given IV bisphosphonates for bone cancers, they come in much higher dosage forms, and those drugs will basically not allow your bone to heal around implants when you have those higher dosage forms. So, that would be an absolute contraindication. Even if you had the best bone volume on your x-ray in the world, if you're on that class of drug, dental surgery is really not something that you can look at. So most of those people, when they get on those, they actually have their teeth removed before they put them on them.
Mm-hmm. I get that question a lot in the consults, and I tell the patients, like, hey, that one's out of my league. We got to consult with Dr. Sam and the doctor that prescribed you that, because I ain't making that call.
Right.
Yeah. All right. Number 5?
Last reason is really just overall health. I think there's a category of people that, the financial component is very, very big for them. and they're very infected. They're having pain. They've got multiple abscesses in their mouth. There are risk for stroke. There's risk for, larger issues that are going to shorten their lifespan if they leave the teeth in. And so there are times when just getting the patient to a more stable health position might trump the other options because, we don't have all the options we'd like to have. So overall health, it would be the last reason where if I'm having a conversation with someone or you're having a conversation and they're saying, that's really nice, but this is kind of what I'm working with, and that's a limiting factor financially. Their teeth may be in a position where I say, you really probably should go ahead and get them out, even though you can only get a denture because you're risking stroke pretty badly. And so that might be a reason. There's other times when they don't have abscesses. Their teeth are broken. They are missing. They are decayed. They do have gum disease, but they don't have active infections. And in those situations, I'll say, really, instead of taking your teeth out, if you can't afford implants, you should just wait.
Because they have time.
They have time. They're not unhealthy from a systemic infection standpoint. And so if they're functioning and chewing pretty well, even though maybe their cosmetics are really poor and their confidence is gone and things like that because of that, if they're functioning pretty highly and they're not infected, we tell a lot of people to sunset their teeth, and we kind of coined that term, and that just means let them, try to keep going the way you're going as long as you can, and you'll either die or you will have more teeth break off or have problems, and at that point your function will lower to a point to where you get more motivated to take action. Yeah. And that seems to work pretty well for most people.
Well, it does, and it makes sense, especially when they're coming in thinking about doing a denture, but I'm still chewing at a 8 out of 10, chewing all the foods I want. My teeth, they're bad, but I'm functioning at a high level. That's whenever it's, hey, let's just pump the brakes and sunset these things. Right. And whenever your functionality goes down, we got some good options for you then.
Right. So kind of recap. I just can't afford. I don't want to afford, but I physically have no way of financially getting access to treatment in any other way. That might make a denture an option. Number 2 is, hey, even though it's not a high functional treatment, we can make them look good. So if you have a terrible cosmetic situation, it might be a stepping stone for you to something else because you need better cosmetics. You need to go to that job interview and be able to smile and glue your teeth in and at least get through that interview to, give yourself a good possibility to maybe gain some ability to save money and get to where you can get implants. Overall health is a big one. Lack of bone for any other options. And then the medical condition with the bisphosphonates, all in the top 5.
Yeah, top 5. Okay, now let's see your list for the reasons why you shouldn't get a denture and should consider your implants.
Yeah, so there are reasons for getting a denture, right? But what we do is implants, and the reason we do that, number 1, above all else, is function. People that transform from existing teeth or even existing dentures, when we make them another set of dentures or make them their first set of dentures and their function isn't as good as they expect it to be, it is a terrible situation for everyone involved. They think we're bad dentists. They think that, we're just another dentist in their past that doesn't know what they're doing. And, those are just poor encounters and poor relationship builders. And so function is, when you select that implant option, and I know I can put a SmileLine in there, and I know I'm going to get you to where you can eat what you want with very few limitations, my ability and my confidence level that I'm going to reach your expectation for treatment is just through the roof. Whereas with dentures, it's basically under the floor.
Yeah, it is. Yeah. I was going through some before and afters yesterday, working on just people that started treatment and then we finished treatment and their delivery photo. And I was looking at a couple of them, and a couple people that we did, they were in an upper and lower denture. They came in for SmileLines. Their starting photo, they were smiling, cosmetics looked good in the denture. Their end photo, their cosmetics looked really good in their SmileLine. Delivery, they were happy. what I found funny is the photos can't dictate their functionality, because we knocked that person's socks off. And their first photos are smiling, last photo they're smiling. It's like, well, you didn't do anything, that patient. It's like, no, we changed their life. That guy can eat steak now.
Right. Yeah. Yeah. I mean, it's huge.
Yeah. All right, number 2 on the list.
Number 2 is just the timeline that it takes to get a patient a denture. So if you come in and you're like, hey, I'm getting dentures.
So you're telling me that a SmileLine takes less time than a denture?
Oh my God. Like, I always tell people, we can get you a denture in 6 months. I can get you a SmileLine in 6 weeks. And, stick around. We'll probably increase that timeline as we move forward and refine our system even more, because the technology is there. There are people out there that are doing it in 24 hours. They're just not doing it very well in 24 hours. So that's why we don't have we can do it in 24 hours.
Yes.
Let me be clear. But we can't do it well and predictably in 24 hours, so we don't do that. But we are working on making it more efficient. And right now it's 6 months or 6 weeks. And, there are cases that vary a little bit from that, but that's kind of the average. And I think that, when you can predictably come for maybe 3-4 visits and be done 6 weeks later versus coming for an unpredictable 8 to 14 visits.
Yeah,
Some people
it
come
can be a
30
lot.
times.
Yeah.
The other system is very unpredictable, because you get this initial denture. We're putting these soft liners in it. We're trying to keep it suctioning. It's falling out. It hurts. You're rubbing sores all over the place. You need all these adjustments. You're healing for the first 6 months, so your ridges are shrinking in dentures. So every day, the denture that we had fitting good yesterday fits worse today. And then we finally get 6 months down the road, and then we have to make you a new denture. And now you've finally gotten used to the temporary denture. And then the new denture fits tighter and rubs new sores. Then we got to go through a whole nother round of adjustments to get the new denture basically into a position where you can tolerate it. Yeah. So the process is just long, and it's a lot of back and forth, especially for our patients that are traveling, over an hour. It's very just difficult to get that many visits.
And for patients that have full-time jobs that are scheduled, like when you coming in for those adjustments, like I don't think my boss is going to let me get off 10, 12 times in a few months, right?
None of it's planned, right? Like there's only like 4 appointments out of that dozen appointments that are planned. All the rest of them are like, oh, you wake up and you're so sore and I need him to take care of this. And yeah, if you're a busy person with a job, like, man, it might cost you more in the amount of time that you're trying to run back and forth unpredictably than, hey, I get my implants. When I get my temporaries, they are supported by the implants, so they don't rub sores. They literally don't touch your gums. They're just resting right against them, but they're not compressing them. And, the timeline is so much more predictable.
The timeline is shorter and more predictable, where you can plan it out. When we're doing SmileLines, they're taking their vacation time and they're getting their surgery and their try-in done in that 1 week vacation time. And after that, like, maybe we have another try-in, but otherwise it's delivery 4 weeks later. That's only one more day.
Right. Yeah.
All right. Are you on 2 or 3 now?
3.
3. Okay. What do you got?
Number 3 reason that you shouldn't do a denture would be just the learning curve. The dentures. Imagine if you put a denture, guys, into a cup of water, and the amount of water that it displaces compared to a SmileLine. Yeah, here you go. The amount of water, the volume of these prosthetics. God didn't invent us to have this in our mouth. He invented us to have something that's the size of our natural teeth in there. And so, with the SmileLine prosthetic being so much closer to the size of your natural teeth, your ability to learn to speak again, learn to chew again, learn to make facial expressions confidently without the teeth falling out, cough, sneeze, breathe. What if you want to go run, exercise? Like, there's so many things in life that are just normal, everyday things that people that have healthy teeth just don't even consider.
Take for granted.
And that people that have removable prosthetics like dentures have to really consider, ooh, can I do that? Jogging kind of is a little bounce. I don't know if my denture will stay in place. And, they're re-gluing it multiple times a day.
Another big one is the gag reflex.
Gag reflex, yeah.
And the reality is the patients don't know ahead of time whether they have a really bad gag reflex and whether they can tolerate it. And it's kind of a shame after you take their teeth out and make them a denture and they try it in and they just gag on it the whole time. And they can't get over it. And I don't blame them. I don't want to put that in my mouth.
Denture, yeah, you know what? This is a good thing we haven't ever talked about. In a denture, guys, there is these two little humps on the back of the inside of the denture. And that is called the post dam or the post-palatal seal. Those humps go behind the hard palate and they push into your soft palate. So your soft palate is just loose tissue that allows you to, it raises and lowers as you breathe, okay? So this pushes in there, and that's where you get that, kind of get that suction for that denture. But that's also where your vagus nerve is. And your vagus nerve is what makes you gag. So we are literally pressing your gag nerve to get suction on this upper denture. It's just how they're made, you know? And so in my experience, if you're a mouth breather, good luck. You're going to gag this denture right out of your mouth. Most people can't tolerate it, and literally to the point where their eyes are tearing up because they're trying to hold it in. And I just feel so bad for them. But, you know, that's why we keep trying to make the SmileLine system just better and better and better so more and more people can get access to it. It's getting better every day.
That's right. Yeah. Lots of positives.
Yeah.
All right. Number 4.
Oh, let's see. What do I got on my list here? Oh, less post-op pain. So the denture is residing on the gums and you're chewing against it. We just took your teeth out. Your gums are sore and swollen and you're trying to eat a little something 3 or 4 days later after surgery. You're kind of tired of liquid food and you try to bite on something and you're,
So putting implants into my bone is less painful than the denture surgery within the realm of the first week.
Well, it's less painful forever. The pain comes from the free nerve endings in the periosteum that cover the bone. The actual bone inside of our bones. You've seen people that have like broken their legs and there's bones sticking out of the wound and stuff like that. They're not even in that much pain. There are very few free nerve endings inside of our bone. And so you can manipulate the bone. You can shorten it. You can put implants into it. I mean, think about what we're doing with hip and knee replacements. I mean, they are getting out hammers and like doing some trauma with this stuff.
Don't watch them on YouTube.
Right. Don't watch those on YouTube. And, you know, the patient, they're having pain, but it's all associated with the musculature and the soft tissue coverings around the surgical site. It's the same in the mouth. So when that denture is compressing the gum in the first days, especially when it's so sore, man, that is a painful, sore situation. And because the implants don't compress that tissue at all, and even an hour after you deliver the temporary, your pain level after surgery is way lower. Now, don't get me wrong, you're gonna have some pain. You know, we have patients take pain medication for a couple of days, but ice in that first 24, 48 hour period is your probably best device. But as far as like I'm talking after that first day or two, just pain from the process comes more from the denture than from an implant and an implant-supported prosthetic like a SmileLine.
Yeah, I hear that a lot in consults. And honestly, in the initial reaction of the patient is like, well, I don't believe you. I don't believe you. Like you're drilling in my bone. You're putting implants.
I don't blame them for not believing. Like I'm a trustworthy guy. It's very logical to be like, hey, a screw in my bone sounds painful. Like, I agree, guys. Like but the biology is a science and it's objective. And I'm telling you, it's been incredible to get feedback. It just doesn't cause the same result as dentures.
You can actually check out our podcast where we have patients on here, and the patients that have upgraded from a denture to the SmileLine, I ask them that. And again, they went through it, and their answer has always been like, yeah, the implants were easier. Then my denture hurt way worse. I was in way more pain for a longer period of time with the denture.
Right. Yeah. And there's probably a category of people that maybe that we didn't talk about with the dentures. Like, I think if you've done really well with the denture for years and you've adapted well, then there might be an argument there to not go up to implants. But we can show you some models here in a little bit that will kind of show you what's happening to most people when they get those dentures as well. Yeah. So what are we up to?
We're up to number 5.
All right. Number 5 is expectations.
Expectations. What can patients expectate?
Yeah.
Expect.
They can expectorate. Expectate.
I get that from my
Chris
dad.
has a speech problem.
I get that from my dad.
It's okay.
Yeah, it's hereditary.
We all know it's not your fault. Stevie's the problem there.
Yeah.
You can expectorate a lot of things. So expectations for implants. Because the function is so much higher, it's just a lot easier to meet patient expectations. And I think that kind of says it all. It's that simple. If you have something that's rigidly supported by your bone, very similar to the way your teeth were supported, well, then you can expect to get a similar bite force that you could with teeth. And, so that's what we're all after when we're getting these prosthetics, really. I mean, I think number one, people would say they don't care what it looks like, which they're lying.
Yeah.
That's not true. But ultimately what they're trying to say is I care more about eating than what it looks like. I want it to look good, but I really want to eat, and it's just so much easier to meet that expectation because it's very similar to eating with natural teeth.
Yeah, I think a good way to put it is, what's your confidence if a patient comes in and they want to chew at least out of 6 out of 10? What's your confidence we can hit it with a denture?
Are they upper and lower dentures?
Yes.
If we're doing an upper and a lower denture, it's almost 0. If I hit 6 out of 10 with an upper and lower denture, I'd be like, lucky on that one. I'm not that good. I got real lucky, and so the predictability is 0.
Yeah, and what about the confidence if we're going upper and lower SmileLine?
Oh, there's not. I'm sure there's somebody out there that would say it was a 6 out of 10, but there's not a chance in my mind that I would think that I couldn't achieve a 9 out of 10 or higher for expectation for chewing with fixed SmileLine prosthetics.
Oh, that says it all then. A 6 out of 10, so 60% of your chewing capacity, and you have almost 0 with upper and lower dentures, and practically 100 with upper and lower SmileLine.
Yeah. And I think we rate 6 out of 10 right at that fault line level where if you go to a restaurant, do you choose what you want to eat or what you can eat? And 6 out of 10 is mostly what you can eat. And right below that, you really start choosing, well, I can't eat that and I can't eat that, so I'm going to eat this for dinner tonight at a restaurant. So that kind of gives people a little perspective for what a 6 out of 10 chewing ability really is.
Mm-hmm. Yeah, their menu's a little bit smaller. Yeah. All right, 6 out of 10. Now number 6.
Yeah, number 6 is that you just don't have to use denture glue anymore. I can't tell you how many times that has been the reason my denture patient, I am so tired of gluing this denture in. And I've even talked to people that do it 8 or 10 times a day. I can only imagine how much they're swallowing of the glue. I don't really know what that does to you, but I imagine that there's a lot of stuff stuck in there somewhere that.
Where's it getting stuck at?
I don't know if it's coming out or not. But yeah, not a good thing.
Yeah, and I see it in the consults. They pull their denture out. You can just see it pulling off between the roof of their mouth and their denture, and they tell me this is so gross. This is disgusting. I hate doing it. Personally, I haven't done it, but I agree with them. It looks rough.
The gums never look healthy when they've got that in there. They're always red and mad. So, yeah, not wearing any denture glue and throwing that stuff away is probably number 6, number 7, yeah.
Yeah.
So, where does that put us?
6 or 7. Do you have a number 7?
I got 2 more.
2 more? Okay.
I lost track. Maybe we're at 17. All right, last kind of overall encompassing one is just quality of life improvement. The patients that come back and say, I wish I would have done it sooner, or just how great the feedback is, or the stories they tell you about what they're eating, or just things they're doing with their family that they probably wouldn't allow themselves to do before. The feedback just proves a quality of life enhancement that we just don't get from dentures.
No. And when you were doing all the deliveries, you were telling me yeah, man, the feedback I'm getting, the common phrase is, I wish I would have done it sooner. Now I'm doing these podcasts with these patients, and I think everyone has said it.
Really?
Because they've all tolerated it to a point to where their functionality is pretty low, and they just struggled with it. And then whenever we knock their socks off with implants. They're just like, why didn't I do this sooner?
My hat is so off to people of Central Missouri, and I think it's a Midwest thing, but people here are tough, and they are conservative, and they don't spend money easily, and so a lot of them go down that denture path, and a lot of them can afford doing something better. I mean, heck, guys, we all have cars that most of our cars cost way more than what we're charging for SmileLine. So it's not really, to me, about affordability. It's about how you perceive the value for what you're getting. And how we perceive the value for a car is apparently pretty high, because cars have gotten really high.
They are very high.
But, we're using this every day as well. You're using your car pretty much every day. For most of us, obviously we're using our teeth every day in many forms. And I think that people in Central Missouri are just, they're just tight. Let's just be honest. And I think that's a great thing to have in your personality. I mean, I think that it's a testament to how adaptable they are and how willing they are to save $1 in the situations when they can, especially when they got kids and maybe there's other priorities. But man, I'm here to tell you, like, the value is there. When no one ever comes back and says that they wish they hadn't have done it, and they all say they're wishing they would have done it sooner, like, that's real.
It's real.
And the sooner you do it, the sooner you realize the value, and the more value you get, because if you do it in 10 years, 10 years to the end of your life, there's less meals, there's less family encounters, there's less social events. So the sooner you do it, the more value you get. The cheaper it is per unit of time. That's what I would really leave people with.
Yeah, because a lot of people, I feel like the time frame that we're replacing a lot of teeth is 55 to 70. The people that are doing it are 55, like, they're getting a lot of miles out of this thing. The people that are doing it at 70 and older, there's a lot more unknowns, once we get past that.
Not everybody needs it at 55, right? Like,
correct.
They may have had a lot of changes from 55 to 70, but there's a lot of people that did need it at 55, and they push it off and they push it off and they push it off. And, I'm here to tell them, like, get the information, learn, educate yourself. Let us help you get educated. And I think you'll see a value that you never expected, because the process is just refined, it's streamlined, it's predictable. And man, it's when everyone says they wish they'd have done it sooner, I think that says it all.
Yeah. All right. Good
last
list.
Last one.
Oh, last one.
Preserve bone.
Oh.
And we're going to do, this is a whole nother segment we're going to do on this. So we're just going to bring that one up, and we'll get into that more next time.
Yeah. All right, guys. Well, thanks for watching the top 5 reasons to get a denture and the top 7 or 8 of why you shouldn't get a denture.
See you next time.